Hi, it's nice to meet you. My name is Finola.
Hi, I'm Jill.
Well, it's nice to meet you, Jill. I'll be your examiner today. And what I'd like to go ahead and do is listen to your heart sounds or otherwise do an auscultation. And I'm really just looking for anything abnormal or any normal signs or sounds that's going on within the heart. Before I actually begin auscultating, it tends to be a little bit of an invasive procedure, so I'd like to go ahead and obtain your consent. Is that okay?
That's fine.
All right, so I'm going to do some inspection here. What I'm looking for is any deformity. I'm looking for any type of, I can feel for a temperature change. I'm looking for a skin rash or anything that just doesn't look normal before I go in and start listening to her heart sounds. Now I'm going to do a cap refill. I'm just making sure that she has circulation or proper circulation going on. I'm going to check for Shamrock's window, and what that is I'm looking for nail clubbing. So give me a Captain Hook on both sides. Oh yeah. So bring them together, and she should have a tiny, I don't know if you want to zoom in on that, but she should have like a tiny diamond-shaped window. Now, if there was a case where she had nail clubbing going on, that window wouldn't be visible. So now I'm actually going to go ahead and do my auscultations.
Okay, now I'm actually going to begin auscultating, and the first valve I'm going to listen for is the aortic valve, which is located at the second intercostal space to the left of the sternum. So we find her clavicle, and then we find her first rib, her second rib, and have her take a deep breath, please. And then palpating the pulmonary semilunar valve, that's just right to the sternum at the second intercostal space as well. Can you take a deep breath, please? All right, next I'm going to palpate her tricuspid valve, and I really just have to slide down 2 intercostal spaces because that's at the 4th intercostal space to the left of the sternum. Deep breath, please. All right, and last but not least, I'm going to palpate the mitral valve. So I'm going to find the midline of her clavicle and just slide all the way down and come to the bottom and push up. Breathe, please. All right, now if her heart sounds were normal, I would jot that down. If there were any abnormal sounds that I picked up, I would actually have her lay down and listen for all 4 valves again. Now with listening specifically for mitral stenosis, we have to expose the mitral valve, and the way we're going to do that is getting her into an attenuation maneuver where she's going to lay down on her side, and that way we're moving the mitral valve closer to the chest wall, and we can listen to it more proficiently. So I would be listening at the same spot. Breathe in, please. All right, and I have to take note if anything sounds abnormal there and jot it down. Now, next thing I'm going to check for is aortic regurgitation, and I'm just going to have my patient lean forward, and I'm going to listen to the aortic valve again, which is going to be to the left of the sternum, or the right of the sternum. All right. And as we go through our auscultations, we just have to make sure we're jotting down anything unusual.
Okay, next I'm going to check for pulse rate, and you can do that at like the dorsal pedal or brachial arteries, but most commonly it's found at the radial artery, so we're just going to find that here at the palmar side of the wrist. And I'm going to use my second and third, my index and third finger. I'm going to ask her to just relax, so go ahead and relax. Good. I'll find that pulse. Okay, so I stopped at 30 seconds, and her heart rate is a little bit fast. I think she's nervous from the video, so she was at 33, so we times that by 2, and that is 66 beats per minute, and that's pulse rate. Next, we go to, that is a normal range though, by the way, 66 is normal range. Then we'll go to respiratory rate, and what I'm going to do is be watching, while I'm talking with Finola, doing her assessment, I'm going to be watching her chest rise and fall. If I'm doing her assessment while she's laying down, that can be even easier sometimes. And I'll be looking for her shoulders rise and fall, her chest to come in and out, her diaphragm working, and I'll set my timer again for 30 seconds. Trying to not let her know that I am actually watching, because her respiratory rate will go up if she's aware. So I'm going to try and do that discreetly. I'm talking to her. Okay, and that's 30 seconds. And she was at 9, and so we'll do 9 times 2, that's 18, which is also within normal range. So that is...
She can have her arm flexed in a comfortable position, preferably at the same level as the heart. I would choose a blood pressure cuff that's the appropriate size. Basically, you just want one that's going to be able to occlude the brachial artery. Once I get the cuff on her, I'm going to palpate and listen to the systolic blood pressure of her brachial artery. And then once I get that, get a sound, I'll pump it up to about 20 to 30 millimeters per mercury above the systolic blood pressure that I'm expecting to get. So I'll go ahead and do that. Gain consent from the athlete. Is it okay if I take your blood pressure? So there's a little arrow that points right to the artery. I'm gonna get it nice and tight. Okay, so just sit with your arm flexed right there. Alright, so I slowly let the air out so I could hear the sounds of quarter cough as it was releasing the air pressure from the cuff. The top number was the systolic and I got 118, and the bottom number was the diastolic reading and I got 68, which is within the normal readings of 120 over 80, so you're good and healthy to go.
Chief complaint, we want to document the symptoms, but if it's related, we want to do like the scale and the intensity of it. So I would ask Vanuela, like, I would show her different scales, and the one that I chose was scale 1 to 10. And how I would explain that to you is like 0 being no pain, 1's like, I can feel it, and then like 10 would be like, I broke my leg. That's what you want to be. So right now, how great is your pain?
Like a 3.
Yeah, okay, so that's good, and we would document that in our chart, and we would move on to temperature. And for temperature, we want to make sure that we, I would ask you if you've had any hot or cold foods within the last 10 minutes, and then we would make sure that we set up the thermometer right, and then put the probe covering on it. And then after that, I would ask you to place this in your mouth under the left or right sublingual, sorry, that thing. And then we're gonna hold it under until it gets an accurate temp.
And then after that, we'll look at it, 98.7, so she is within normal ranges.